Today, I'm going to discuss a very interesting case. A case which has very interesting ramifications about different aspects of our life. This is about a patient, a 96-year-old lady whom I recently operated at Apollo Hospital. Now, this lady was bedbound for nearly 8 to 10 days following a fall. She could not move both her lower limbs, and in Hindi we say ki khaat pakad liye. So what does it mean? It means like, okay, you are on your deathbed now, nothing more can be done. This is the normal attitude that people have. But thankfully, this patient as well as her relatives, I should actually congratulate the relatives too, because they had taken the initiative to get this 96-year-old lady who is now bedridden to a hospital for further treatment. Now that is also okay if you understand. Further treatment for an illness is a normally accepted thing. But now she was coming to me for a spine surgery. And normally the notion is, when I interact with my usually other patients, all of them tell me that, my relatives have told me that undergoing a spine surgery means I'm doomed. So here you have a lady with coming out of a community with this kind of a notion prevalent there. So she came here at the age of 96 and came to me for surgery. Interestingly, she was very positive right from the first day I saw her. She wanted to get better because she was better all along. She was managing all her work till around 8 days ago. In fact, she was helping out at home too. So 96, that number itself hardly means anything. It's about how active you are and how useful you are to the community as a whole, to your family as a whole, and to yourself as a whole. That matters. That number 96 does not hold much value. We tested her for all the basic health checkup. The blood tests were done, the 2D echoes, the x-rays, everything was done, and finally all of them gave me results which actually surprised me. Even a 25-year-old person could easily carry that report around and say that he's healthy. So this 96-year-old lady was sporting that kind of health. And now I had no reason to not offer her what I would offer to any other person. And I eventually ended up offering her surgery, which I thought might improve her condition. So I operated on her. What we did was we did something called as a laminectomy. In fact, it does not require too much of a surgical skill also for that. So I wouldn't talk about my surgical expertise over here, because it is a routine surgery which I performed on her. I removed the spinal lamina. I saw a large clot sitting over there, compressing the cord. I removed that and closed the patient up. So overall, in fact, if you look at the set of surgeries that we as neurosurgeons do, this would be one of the most simpler ones. But for this patient, it proved to be miraculous surgery, because the next day when I went to meet her, she was up on her feet. So what we saw, that a timely done procedure, the right kind of patient, the right mental attitude gives us really phenomenal results. And age should not debar her from seeking medical attention. And this attitude we generally carry. About 2-3 things is debunked completely over here. First, yes, age. Second, the fact that once an old person is on the bed, it means that he's on a deathbed. That attitude which we carry is again something which we have to throw out of the window. And third thing about spine surgery itself. So here we've done exactly opposite of what people anticipate. What people think about spine surgeries, you come, get operated, and then again go on the bed. Over here, what we had was a patient who came on the bed, couldn't even walk, couldn't even move her legs, to the hospital to me. We operated, and the next day she was up and about and waiting, raring to go back to her normal life. And the take home message over here would be, no matter what age, no matter what the clinical status, it always makes sense to seek a good medical opinion. Trust your doctor and take it from there. So that would be the way forward, instead of just assuming that things are bad and things are a situation of no return. So the key over here is have a positive attitude towards everything in life, including the illnesses that you have. Try and come out of it successfully, and that is exactly what we learned from this 96-year young lady. Thank you.